I'm Janetti Andrews. I'm the Dean of the College of Nursing, and I'm so excited to extend greetings and welcome to you in joining our white coat ceremony for graduate students here at the College of Nursing. This is an incredibly special day that is both symbolic for your entry into advanced nursing profession, as well as a celebratory occasion with your family and friends. Today marks a major milestone for your future career as a nurse practitioner or a nurse educator. Family, faculty, staff, and friends, let's give our first round of applause to our students here today. I'd also like to welcome those of you who are joining us online. We do have an online audience from around the world. So our platform party, if I may introduce them, when I say your name, if you stand, Dr. Robin Dawson, our Interim Associate Dean for Academics and Accreditation. Mr. Brandon Boyd, Advanced Practice Nurse Practitioner and Family Nurse Practitioner, Lexington Family Practice. He'll be our alumni and speaker. Dr. Rachel Bush, Co-Director of our Psych Mental Health Nurse Practitioner Program. Mr. Wright Culpepper, Assistant Dean of Student Affairs. Dr. Amy Devendorf, Director of the Adult Gerontology Acute Care Program. Dr. Shelley Gibbs, Director of the Family Nurse Practitioner Program. And Dr. Carolyn Harmon, Director of our Healthcare Leadership, Nursing Informatics, and Nursing Education Program. Let's welcome them. And of course, I'd be remiss if I didn't introduce the heart and soul of our college, our world-class faculty. I hope you all take the opportunity to get to know the incredible faculty here at the College of Nursing during your journey. I'll ask our faculty here to please stand. I often say it takes a village to support our students during this rigorous and stellar program. Many of our family members today, I'm sure you drove hours to be here or flew in from around the country to be here today. Family members provide much needed support along the journey and hopefully dinner after this, right? And we would like to recognize you at this time. Graduate students, would you stand, turn around, and welcome your family and friends here tonight. We have tonight graduate students participating who enrolled in either the Adult Gerontology Acute Care, Family, and Psychiatric Mental Health Nurse Practitioner programs, as well as our Nurse Education program. All of these students are in their early phases of clinical rotations and are here for their first on-campus immersion. I want to thank you for choosing the University of South Carolina College of Nursing. I'm biased, but I think you've chosen an incredible place. We're currently ranked for the fourth year in a row, #1 in the country by the U.S. News and World Report for our graduate online programs. We're in the top 1% of the country for our NCLEX pass rates for BSN students, and 100% first-time pass rates for adult gerontology, acute care, and psych NP certification rates for the past year. We also have top rankings in the National Institutes of Nursing Research for our research programs. We aspire excellence and quality in all that we do and uphold our values of the college, which are professionalism, integrity, caring, diversity, respect, inclusion, and commitment. The faculty and staff here are committed to your success, and we look forward to your journey. So Brandon Boyd is a family nurse practitioner with the Columbia Medical Group and internal medicine office with the Lexington Medical Center. He's a native of Aiken, South Carolina. He earned his Bachelor of Nursing from the University of South Carolina in Aiken. He then earned his Master's of Science in Nursing, Family Nurse Practitioner from the University of South Carolina. In his practice, he manages patients with acute and chronic conditions. He also inspires the next generation of nursing professionals. He frequently works with students in a clinical setting, and he's worked with us as a clinical faculty for courses and on-campus immersions in the Family Nurse Practitioner program. Brandon is most proud to serve his wife of 8 years and his 2 sons. Let's welcome Brandon.
Good evening. I'm honored to stand here before you on this momentous occasion. This event marks a significant milestone in the journey of aspiring nurse practitioners as you transition from students to professionals who will make a profound impact on healthcare. Today is a testament to your dedication, perseverance, and unwavering commitment to the nursing profession despite the hard work and self-sacrifice. You are managing being a student while also being a friend, a fiance, a spouse, a parent, an employee, just to name a few of the roles, and this can feel overwhelming at times. So I want to applaud you for all of your efforts and all that you will accomplish. I remember being in your position a few years ago, and I want to tell you that it's all worth it. Being able to serve someone who needs help is a wonderful and fulfilling thing. So why a white coat? Prior to this ceremony, I conducted some research on my own on the white coat, and it turns out things have changed significantly over the last 120 years. There was a shift around the start of the 20th century. Prior to this shift, providers wore black coats and clothing while practicing. Medical visits were thought to be incredibly formal and serious events. And I'm personally thankful for this change because South Carolina summers are much too hot for black coats. Then healthcare began to progress and change. Antibiotics were discovered. Antiseptic techniques were becoming more important in operating rooms. Cleanliness and antisepsis were a core aspect of healthcare. The white coat began to symbolize cleanliness and purity. The white coat is now worn by providers and scientists in multiple fields. It is a symbol of clinical knowledge and skill learned through years of training. It is an honor to be able to wear. It has also come to symbolize compassion and empathy, the cornerstone of nursing care. As you go out into the clinical setting, you will be able to serve as advocates for your patients, providing holistic care that encompasses physical, mental, and emotional well-being. But remember, wearing this coat is both a privilege and a responsibility. I hope you always feel its weight on your shoulders. It is a commitment to upholding the highest standards of patient care, lifelong learning, and ethical practice. Despite the challenges that come with this season in your life, you are surrounded by support and opportunity. I encourage you to treat each patient encounter as an opportunity to support or to grow and gain experience. Utilize your time with preceptors to ask questions and have conversations to learn from someone who is further along on this journey. The excellent faculty, advisors, and mentors at the College of Nursing also support you. They are committed to an excellence in nursing education and want to see you thrive in this field. They will gladly support you and guide you throughout your training. Do not be afraid to reach out to them. To the families and loved ones, I want to say thank you. Thank you for your unwavering support and understanding throughout the journey of these students. These students would not be here without your love and support, and if I remember correctly, meals and caffeine are always accepted and appreciated as expressions of your continued love. So I will leave you with this. A provider I worked with during one of my clinical rotations had a small yellow sticky note beside his computer, and it read that life's most persistent and urgent question is, what are you doing for others? Which is a quote from Dr. Martin Luther King Jr. I read that note hundreds of times and decided that I agree. Every day we should ask ourselves, how can I serve those around me? This quote continues to impact my practice today. I have it taped to my computer monitor at the office. We as nurses are given the amazing opportunity to meet people and their families at a time when they are vulnerable. I ask you to serve them, be present, and make a difference for someone. I encourage all of you to continue your hard work. With the knowledge and skills that you gain here at your time at the College of Nursing, you can pursue a career you love, push the field of nursing forward, and most importantly, serve others and make a positive impact on every person you meet. Thank you.
Thank you, Brandon. We do have an incredible opportunity to serve others who are in need, so what a great profession and what a great calling we have. It's now my pleasure to introduce Dr. Rachel Bush, our co-director for our Psych Mental Health Nurse Practitioner Program.
Good evening. It's a true honor to be here with our esteemed faculty, our distinguished guests, and most importantly, our exceptional nurse practitioner students as we celebrate this momentous occasion. The White Coat Ceremony. This event signifies a profound landmark in your journey towards becoming nurse practitioners, and it's a privilege to be with you all on this important day. It's also personally a humbling experience for me. During my schooling, it felt like I would never get finished through the many sleepless nights and caffeine-fueled study sessions, and yet I did, and so will you. Although I don't know each one of you personally, there are a few things I do know about you based on your ability to be here today. And so I wanted to reflect on those for just a few minutes. You have compassion. There is a reason that nursing is referred to as the caring profession. As you become nurse practitioners, your ability to listen, to empathize, and to comfort others will be essential in providing the highest quality of care. You don't have to look very far in our society to see the lack of these qualities these days. Frustration, impatience, and a lack of empathy and grace is endemic in our society today, and unfortunately in healthcare settings, some of them. And that's why we need you. Nurses are distinguished by the ability to treat people, not just a diagnosis. Technology, diagnostic manuals, and evidence-based treatments are essential in practice, but the greatest tool you have is your heart. Don't forget to see your patient. Treat the person, not just the disease. Your compassion will be a source of healing itself. Another thing I know about you is that you have determination, something that my father used to call grit. Your journey to this moment has been filled with countless hours of study, clinical experiences, and dedication. You have overcome hurdles, you have pushed boundaries, you have expanded your horizons, and adapted to shifts in roles and responsibilities. Don't worry, and guess what? You'll get to keep doing this. The life that you are entering is an ongoing journey, not a destination. Providing health care may offer many struggles, but nurses don't give up. As Dorothea Dix, a nurse from my specialty, stated, "They say nothing can be done here," and I reply, I know no such word in the vocabulary I adopt. There will be challenges and hurdles, but you have been proven to be up to the task. Another thing I know about you is that you have a calling. Out of all the healthcare traditions, nursing has the best history of holistic care. We treat body, mind, heart, and spirit. At the root of calling, it recognizes that becoming a nurse practitioner is not just a career choice, it's a life choice. It's a way of life. It's a willingness to take on the messiness and the pain of humanity while also providing hope and healing. Another thing that I know about you is that you are capable. Look how far you've come. This is no easy task that you have just done. You have already been able to endure the rigors of the academic requirements and the clinical performance and are ready to take the next step. Nursing has its tradition of giving its students powerful symbols of change, progression, and maturity, while also bestowing a sense of mission or responsibility. Historically, it's been a cap and then a pin, and tonight we have the white coat. The white coat symbolizes the significant responsibility as well as the immense trust that is being given to you as future healthcare providers. It is also a reminder of the profound commitment that you are making to the well-being of others. As you receive your white coat today, consider it an honor to wear, and remember that your journey is just beginning. So in conclusion, tonight's white coat ceremony is a testament to the hard work, to the dedication to patient care that you guys have already demonstrated. And as you embark on this noble profession, wear it with pride. Congratulations, future nurse practitioners. I have no doubt that you will make a lasting and positive impact on the lives of the patients you will serve, and it's an honor to be a part of this night with you. Thank you.
Thank you, Dr. Bush. Now we have Dr. Robin Dawson, our Interim Associate Dean of Academics and Accreditation, to say a little bit more about the white coat, and then we will begin.
So what is the ceremony about? The white coat originated for use in a scientific lab and was adopted as the standard of dress by physicians in the late 19th century when physicians sought to incorporate scientific principles in the practice of medicine. The white coat ceremony was created by the Arnold P. Gold Foundation more than 25 years ago for medical students. And in 2014, the Gold Foundation and the American Association of Colleges of Nursing marked coordinated efforts to develop a ceremony for nursing students. The donning of the white coat is a long-standing tradition which distinguishes healthcare providers from other community members. The white coat is a symbol of our profession, of professionalism, integrity, honesty, excellence, compassion, and sacrifice to unconditional care of others. For USC nurse practitioner students, it symbolizes the accomplishment of successful completion of the core nursing courses and you beginning your clinical rotations. It also signifies and honors our College of Nursing values of diversity, inclusivity, commitment, caring, integrity, respect, and most importantly, professionalism. Your white coat will serve as a symbol and honorable recognition as a healthcare provider, and also as a repository for resources including your handbooks, manuals, reference cards, your stethoscope, your pen lights, and oh, so much more. Now, let us meet our deserving USC College of Nursing graduate students.
I just want to make a minor edit that we have a nurse educator student with us as well who are receiving a white coat, so we also want to recognize her, which we will shortly. So I'm going to ask Mr. Wright Culpepper, our Assistant Dean of Student Affairs, to come forward and call your names, and we'll get the ceremony started.
Tonight, we recognize students in our Adult Gerontology Acute Care Nurse Practitioner, Family Nurse Practitioner, and Psychiatric Mental Health Nurse Practitioner programs. Dean Andrews, Dr. Dawson, and Dr. Amy Devendorf, Director of the Adult Gerontology Adult Care Nurse Practitioner program, will congratulate the Master of Science in Nursing degree students in that program. Will the students please rise and come forward? Angela Curler, Master of Science in Nursing. Anthony Dawkins, Master of Science in Nursing. Jenna Harris, Master of Science in Nursing. Anna Long, Master of Science in Nursing. Amber Neal, Master of Science in Nursing. Bruna Pereira, Master of Science in Nursing. Callie Vinson, Master of Science in Nursing. Sabrina Wimsett, Master of Science in Nursing. Angela Kazia, Doctor of Nursing Practice. Danielle Winkler, Doctor of Nursing Practice. Haley Avor, Master of Science in Nursing. Dr. Shelley Gibbs, Director of the Family Nurse Practitioner Program, will assist Dr. Dawson in presenting coats to the Master of Science in Nursing degree students in that program, followed by the Doctor of Nursing Practice degree students. Caroline Beard, Master of Science in Nursing. Mandy Birch, Master of Science in Nursing. Elizabeth Burr, Master of Science in Nursing. Amy Kristen, Master of Science in Nursing. Sarah Covington, Master of Science in Nursing. Marlo Crowder, Master of Science in Nursing. Lindsay Gibson, Master of Science in Nursing. Avery Graves, Master of Science in Nursing. Lydia Gross, Master of Science in Nursing. Samantha Herrera, Master of Science in Nursing. Elisa Hook, Master of Science in Nursing. Dominique Lyons, Master of Science in Nursing. Shreya Patel, Master of Science in Nursing. Alexa Roman, Master of Science in Nursing. Ashlyn Smith, Master of Science in Nursing. Caroline Sparks, Master of Science in Nursing. Alessandra Stank, Master of Science in Nursing. Julia Euland, Master of Science in Nursing. Grace Weston, Master of Science in Nursing. Taylor Williams, Master of Science in Nursing. Ann Cook, Doctor of Nursing Practice. Brandon Davis, Doctor of Nursing Practice. Caitlin Flynn, Doctor of Nursing Practice. Kobe Hughes, Doctor of Nursing Practice. De'Erica Wilkes, Doctor of Nursing Practice. Dr. Carolyn Harmon, Director of the Nursing Education Program, will assist Dr. Dawson in presenting coats to the Master of Science in Nursing degree students in that program. Andrea Johnson, Master of Science in Nursing. This concludes the presentation of our students. We congratulate you on your accomplishment in being admitted to this acclaimed program. Please join me in congratulating all of these students.
This never gets old to me, and y'all been well behaved. I'm going to give you one more time to go wild, but not yet. Dr. Shelley Gibbs is going to come forward and leading us in an oath.
All right, so I'm going to have y'all stand up, and then you can see it on the back of y'all's pamphlet or your brochure. Got it? All right. Y'all going to repeat after me. Or repeat with me, I should say. As a nurse dedicated to providing the highest quality of care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns, act in compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients, exercise sound professional judgment while abiding my legal and ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of the patients. With this pledge, I accept duties and responsibilities that embody the nursing profession. Full realization of the responsibility with which I am entrusted by the public. Congratulations, you guys.
So you can be seated. So we're nearing the conclusion, but I'm going to give you one more chance to really show them how proud you are. So let's stand up and give them an ovation here. Yes! Awesome. Thank you. They've worked really hard to get here, and they've had a pretty long 2 days so far, right? So I know they're glad to be cheered on by us. What a privilege it is to see this next generation of nursing students who are our future of nursing. We're so glad to have you and our family and friends join us today. I'd like to thank the Office of Academic Affairs and our IT staff for helping to plan this ceremony. When we conclude in just a few moments, the faculty will leave the platform, the faculty will follow us, and the students will follow us after that. If the parents will stay and friends stay seated for just a moment to let us get out. We're going to go, if it's not raining, we're going to go on the front porch outside and take a nice group photo, and then we're going to come back in and greet our family. And the family, you can come take photos with us too. So that'll be at the end, but we're in for a real treat now because we're going to sing our alma mater, and we have Jessica McCormick, who's going to lead us in the first verse of the alma mater. After that, we'll proceed out. Thank you, everyone.
Please rise and join us as we sing the first verse of the alma mater. When we get to Here's a Health Carolina, we will all raise our right hand as if we're making a toast. Okay. We hail thee, Carolina, and sing thy high praise. With loyal devotion, remembering the days when proudly we sought thee, thy children to be. Here's a health, Carolina.